Live from WFAA, it's midweek, and this is Good Morning Texas. And then there were three, and Amy witnessed every step. She's got your backstage ticket to Dancing with the Stars. Then another Tiger to watch. This one a rising star from Booker T. Washington High School for the Performing and Visual Arts. Meet Tiger Darrow. And oh, those aching knees. When do you need to see a doctor? GMT starts now.
Up next, find out when you need to go see a doctor for knee pain relief. We'll be back. Sliding into home base playing softball, or maybe just overdoing the yard work, we put our knees through a lot, especially in the summertime. But do you need to see a doctor for that knee pain? Dr. Grear Hurt of All-Star Orthopaedics and Sports Medicine knows the answer. First of all, Dr. Hurt, the man who takes away the hurt. I think it's a perfect name for an orthopedic surgeon.
I think it's a good name for an orthopedic doctor. People don't seem to forget it. It seems to lighten up the mood a little bit when somebody comes in with an injury.
So, summertime is upon us. People are starting to get more active. They're starting to get moving out there. What kind of injuries do you typically see this time of year?
Well, we see a lot of bone, joint-related injuries in an orthopedic practice. We see a lot of injuries, in particular to the knee at this time of the year. A lot of people are out playing with their kids, playing sports. Maybe they're trying something new. They have a twisting injury or a squatting, jumping, landing type injury, and they hurt their knee. It may bother them a little bit, or it may bother them a lot.
Well, and also a lot of us may be coming off from a long period of inactivity. Not me, of course, but some people kind of sit around all winter long and stay inside and don't get active, and then all of a sudden you go out and try to do too much, too soon, too fast, and
Absolutely.
You twist something. So how do we know when that injury is something we ice for a couple of days and forget about, and when is it time to go and see a doctor or an orthopedic surgeon?
And I think that's the question that we all ask ourselves, is when do you need to go see an orthopedic doctor? And I think that when talking about a knee injury, you look for swelling, you look for pain that doesn't go away, you look for what we call instability or looseness of the knee. It doesn't feel quite right. In particular, we look for mechanical symptoms, things such as locking or catching in the knee. It feels like it doesn't want to bend all the way, those types of things. At All-Star Orthopaedics, our practice, we've got 8 different doctors, we've got 3 different locations, so we try and make it easy for the patient to come in and see us, and we don't want a big time delay.
So you don't have to, it's not a big deal to come in, to get in, get out, and get it checked on, so don't take any chances. If you feel like something's going on, have it looked out.
Exactly.
What do you guys do? How do you then diagnose what's really going on?
Well, so what we typically do is there's no substitute for a good clinical examination by your orthopedic doctor. This is done in the clinic, and also we also use x-rays, MRIs. These are things that can help us make an accurate diagnosis.
So what are the ways that you treat some of the things that go on? What tools do you have in your wheelhouse?
Well, if there's an injury, we obviously will try conservative treatment. We'll try physical therapy, maybe some rest, ice, anti-inflammatories, that sort of thing. There's a lot of injuries in the knee particularly that will not heal themselves, cartilage injuries or ligament injuries. And these typically, if these need a surgery, there are some little things that we can do. In particular, I do a lot of knee arthroscopy, and this is a procedure, we have a knee model here. It's a procedure where we do 2 small incisions on either side of the kneecap. One, we put a camera in, and through the other portal or a small incision, we're able to put some instruments specifically designed to take care of the torn cartilage. And this is a minimally invasive procedure. Patients are back on their feet pretty quickly.
2 small incisions. How much downtime is there usually with that?
There's usually just a couple of days downtime. I encourage people to get back up on their feet and start walking right away.
All right. So really, any good prevention things you can tell us to keep us from having to come in and see? If you had one tip, we've got 30 seconds left. What can we do to stop from injuring our knees?
Well, prevention-wise, we do a lot of stretching. I encourage people to ramp up into activities. I think that that's always important. And if there is an injury, I think it's good to come and see your orthopedic doctor. I think that any question or concern that you may have, just give us a call. We'd be happy to see you.
All right. Thank you so much for being here. If you want more information, you can call them, All-Star Orthopaedics and Sports Medicine, at 972-556-2885, or log on to allstarortho.com. You can also find out more by calling Pine Creek Medical Center, 214-231-2273, or log on to pinecreekmedicalcenter.com.